Doci, a Nigerian-based healthcare platform, is seeking to connect healthcare professionals to people that need medical advice and support. From the comfort of their homes and at the touch of a button, users can request an appointment with a doctor via the app. Like some other countries in Africa, access to healthcare in Nigeria can be challenging, so the idea was born out of the need to close the accessibility gaps of traditional channels.
What we're trying to do with Doci Healthcare is to solve the problem of healthcare accessibility. We've realized within our society that there are a number of, one of the biggest healthcare challenges is just people's ability to access healthcare when they need it, how they need it, and their ability to make choices as to what kind of care they want. Typically now, the only choice people have with accessing healthcare is you walking over or driving over or taking transportation to the closest healthcare center. That's all you can do, and whatever you see when you get there, you have to just go with the flow and accept it. What we would like to do is to make it possible for people to have more choice on how they access healthcare.
The health tech platform is also an avenue for healthcare professionals to network and share tips with an intent to reduce waiting times, address problems of access, unpredictable cost and choice of provider, among others. A recent innovation in Nigeria aimed at tackling health needs and challenges in the country using technology.
The Doci Healthcare app, you can make decisions about the kind of healthcare professionals you want to see, the gender of the healthcare professionals you want to see, even the language that you would like to converse with a healthcare professional in. So it gives you more choices, it gives you more flexibility. It takes away the fact that you don't have to now go and queue up to get a card to see a doctor. You book a doctor when the person is available. Once you have a conversation with the general practitioner, either by voice, either by chat or messaging, that healthcare professional, either he provides you with solutions or he points you in the right direction. Whether you're going to be able to see a specialist, or you're going to be able to, or you need to go for a lab test, or he could just generally prescribe what you need to do to get treated.
By merging healthcare with technology, the digital platform seeks to improve people's access to healthcare.
In Doci Healthcare, we have the founders of Doci Healthcare are tech people as well as people in the healthcare space. We have a certified medical doctor as part of our founding team. We also have people in technology as part of our founding team. So what we've been able to do is to merge those two disciplines together so that we can provide a solution that makes sense for everyone.
Although the founders say their goal is to improve the traditional methods, George says a lot of convincing comes into play when getting the public to use the app.
We have looked at the whole process of accessing medical healthcare. We have looked at every step of the way, and we've realized that there are a number of bottlenecks that exist for people. There's the difficulty of using technology. A lot of people are reluctant to use technology. Some people feel that you cannot get healthcare using technology. So we have made it as simple as possible for people to sign up, to set up their profiles on the Doci app, and we have made the journey from you having a medical condition to you receiving a consultation with a doctor as simple and as straightforward as possible. We have tried to reduce the steps continuously. Another problem with accessing healthcare, the way people do online, is how are you sure you're talking to certified, licensed, credible medical practitioners. So we have a partnership with the Medical and Dental Council of Nigeria to ensure that only certified medical doctors with the council are set up on Doci. So we're very, very stringent about the doctors and the healthcare professionals that we have on the platform.
Funding is a general challenge many startups face, but for this healthcare startup, there's more. They say some doctors are skeptical about their method.
One of the first challenges we had was the fact that it was getting the acceptance of the fact that people can actually access healthcare using applications. So when we initially began to speak to healthcare professionals, a number of people were skeptical about the fact that that people must come to a hospital or must come to clinic before they can actually see a doctor and have a proper consultation. But we made them realize that with, if they're able to pick up, on the app, we're able to pick up basic healthcare information about the person's, blood pressure, genotype, blood group. If we're able to do that kind of initial clerking, and if the doctor can ask the patient the right questions within the app, it is still certainly can replace the need for a physical consultation. And what we cannot find out, over the app, we recommend that the patient goes through a lab test. And the results of a lab test, once the doctor sees the results of a lab test, and with the basic information, it gives the doctor insufficient information to make to make proper diagnosis and proper recommendations, at least at the primary healthcare level.
With the Doci app, the team aims to support the healthcare space in Nigeria by empowering professionals and providing another revenue earning opportunity for them.